The intestines have several important roles in the body. Some of these include supporting the digestive system, ensuring nutrient absorption, and having an effect on the immune system. The intestines are an important part of the digestive system, and they digest food and ensure the absorption of nutrients. Bacteria in the intestines aid the digestive process and play a role in the production of some vitamins. Besides this, the intestines have a great impact on the immune system. The immune system is a defense mechanism that protects the body against diseases and is largely influenced by microbes in the intestines. Finally, the intestines also have an impact on the nervous system. There is a strong connection between the gut and the brain, and in some cases the gut can affect emotional states and brain functions. These versatile effects of the intestines on the body reveal the importance of a healthy digestive system and overall body health. Eating habits and lifestyle can greatly affect gut health. Intestinal diseases can have many different causes, and the origin of these diseases is usually a combination of several factors. Some common causes of intestinal diseases are genetic factors. Some intestinal diseases are associated with genetic predisposition. Having family members with such diseases may increase a person's risk of contracting such diseases. Immune system problems. Many intestinal diseases are caused by problems with the immune system. The immune system may mistakenly attack the body's own tissues, leading to intestinal inflammation. Environmental factors. Some environmental factors can negatively affect intestinal health. For example, factors such as stress, various chemicals, and smoking may play a role in the emergence of intestinal diseases. Nutritional habits. Inadequate or unbalanced nutrition can lead to some intestinal diseases or worsen the existing condition. Consuming excessively fatty, processed, or fiber-free foods can negatively affect intestinal health. Microbiota imbalance or disruption of microorganisms, intestinal flora, in the intestines can contribute to the emergence of intestinal diseases. This may be associated with factors affecting the balance of probiotics or prebiotics. Infections. Intestinal infections can also cause intestinal diseases in some cases. For example, bacterial or viral infections can lead to inflammation in the intestines and develop long-term disease. The exact causes of bowel diseases may vary depending on the individual situation and disease. Treatment and management are often determined by the type of disease, symptoms, and the person's particular situation. Early diagnosis and appropriate treatment can help control many bowel diseases. Indigestion is a symptom that occurs in disorders related to the digestive system. It usually manifests itself with symptoms such as discomfort after eating, bloating, gas, stomach pain, or burning. This may occur for a few different reasons. Improper nutrition. Consumption of heavy, fatty, processed, or spicy foods can strain the functioning of the digestive system. At the same time, eating habits, eating quickly, not chewing enough, can negatively affect digestion. Stomach acid problems. Excessive stomach acid or backflow of stomach acid into the esophagus, reflux, can cause problems in digestion. Lactose or gluten intolerance. Some people may be sensitive to foods such as lactose, intolerance to milk sugar, or gluten, intolerance to grain proteins such as wheat, barley, rye. In this case, consumption of these foods may cause indigestion and other digestive problems. Stress or anxiety. Mental stress or anxiety can have an impact on the digestive system and cause indigestion. Stomach infections. In some cases, bacterial or viral infections can affect the stomach and digestive system, leading to symptoms of indigestion. Indigestion can often be alleviated with measures such as lifestyle changes, dietary adjustments, and stress management. However, in case of severe or persistent indigestion, it is important that you be examined by a healthcare professional and have the necessary tests done to determine whether there is a serious underlying health problem. In this way, the correct treatment methods can be determined. Intestinal diseases can vary widely, and the symptoms of each disease may differ slightly. However, in general, common symptoms of intestinal diseases can be abdominal pain and bloating, constant or intermittent pain, cramps, or a feeling of bloating in the abdominal area are common symptoms of intestinal disorders. Changes in stool. Intestinal disorders often lead to changes in stool. Conditions such as diarrhea, constipation, or blood in the stool may be symptoms of these diseases. Gas problems. More gas formation than normal or frequent burping may be among the symptoms of intestinal diseases. Weight loss. Sudden and unexplained weight loss can be one of the symptoms of some intestinal diseases. Fatigue and weakness. Chronic intestinal disorders can affect the absorption of nutrients in the body and lead to symptoms such as fatigue and weakness. Fever. Some intestinal diseases can cause fever as a result of inflammation or infection. Unintentional weight change. In some cases, intestinal disorders can also cause involuntary weight gain. Symptoms of intestinal diseases often vary from person to person and may differ depending on the type of disease, its severity, and how it affects the body. If one or more of these symptoms persist or become severe, it is important to consult a healthcare professional. Early diagnosis and treatment can help control symptoms in many intestinal disorders. Folk medicine includes a number of natural methods and traditional practices to improve gut health and treat some intestinal problems. Here are some folk medicine methods and treatments. Herbal teas. Some herbs, especially herbal teas such as mint, fennel, ginger, and chamomile, can have relaxing effects on the digestive system. They can facilitate digestion and calm the intestines. Probiotics and fermented foods. Probiotics and fermented foods such as yogurt, kefir, and pickles can support intestinal health. These foods can restore the balance of healthy bacteria in the intestines and strengthen the digestive system. Fiber foods. Foods rich in fiber can regulate digestion and support bowel movements. Fiber foods such as vegetables, fruits, and whole grains can be beneficial for improving gut health. Natural medicinal herbs. Some traditional herbal medicines or herbal mixtures are used to improve intestinal health. For example, aloe vera juice may help reduce inflammation in the intestines. Stress management. In folk medicine, the effect of stress on the digestive system is important. Stress reduction techniques such as meditation, yoga, and deep breathing exercises can positively affect gut health. Natural oils. Some herbal oils, such as ginger, peppermint, or chamomile, can soothe the intestines and alleviate digestive problems. These oils can be used through massage or aromatherapy. Folk medicine methods may differ from person to person and may not be equally effective for everyone. It is important to always consult a specialist regarding the treatment or methods to be used. Some bowel problems may require more serious medical attention, so it's important to follow your healthcare provider's directions. Foods that support gut health can often be high in fiber, probiotic, or have anti-inflammatory properties. Here are some food suggestions that are beneficial for maintaining intestinal health. Fiber foods. Vegetables such as broccoli, cabbage, cauliflower, fruits such as apples and pears, fiber-rich foods, such as whole grains and legumes, can regulate the digestive system and support bowel movements. Probiotic foods. Fermented and probiotic-rich foods such as yogurt, kefir, pickles, and kimchi can balance the intestinal flora and benefit the digestive system. Natural fats. Healthy fats such as olive oil and coconut oil can help the intestines function regularly and reduce inflammation. Fish. Oily fish such as salmon and sardines, which are rich in omega-3 fatty acids, can support gut health and reduce inflammation. Protein sources. Protein sources such as turkey, chicken, eggs, and tofu can provide amino acids that are important for maintaining intestinal health. Pomegranate, ginger, mint. Some foods that have anti-inflammatory effects can reduce intestinal inflammation and soothe the digestive system. Water. Drinking sufficient amounts of water regulates the digestive system and supports intestinal health. Water helps soften stool and regulate bowel movements. Different foods may work better to support each individual's gut health. Creating a balanced eating habit and including these types of foods in your daily diet can support overall gut health. However, it is important to consult a healthcare professional, especially if you have a serious intestinal condition. Intestinal inflammation refers to a condition of inflammation that usually occurs in the intestinal wall. Inflammation can occur in various areas throughout the digestive system and can be caused by a variety of reasons. Inflammation can be associated with inflammatory bowel diseases such as Crohn's disease and ulcerative colitis, as well as conditions such as intestinal infections, nutritional allergies or sensitivities, and bowel cancer. Symptoms of intestinal inflammation may include abdominal pain and cramps, constant or intermittent abdominal pain and cramps, stool changes, diarrhea, bloody stools, constipation, or changes in stool, Colon cleansing is a term that often has many different meanings and can include a variety of approaches. However, it generally refers to some methods performed to cleanse the body of toxins or accumulated waste from the intestines. Some methods called bowel cleansing may include laxatives or clinical intervention. Some people may attempt to cleanse their bowels using laxatives or with special cleansing procedures done in a clinical setting. However, prolonged use of laxatives or excessive cleansing procedures can harm intestinal health and should not be done without specialist supervision. Liquid diets or strict eating plans. Some people may try to cleanse their bowels by consuming only liquids for a certain period of time or with a special diet. These are generally not healthy long-term and can lead to an unbalanced diet. Fibrous foods and liquid consumption. It is thought that fibrous foods and drinking enough water can help naturally clean the intestines and support the digestive system. Intestinal cleansing may involve short-term intensive cleansing methods instead of a long-term healthy eating habit. However, your body is built on a system that can naturally eliminate toxins and cleanse the intestines. To maintain intestinal health, lifestyle factors such as a balanced diet, drinking enough water, consuming fibrous foods, regular exercise, and avoiding stress are generally recommended. If you have concerns about your gut or are considering a special cleansing method, it's important to talk to a healthcare professional. Your specialist can recommend healthy bowel care methods that are most suitable for you. Bloating and gas, constant feeling of bloating and increased gas formation. Fever. In some cases, inflammation can lead to fever. Fatigue and weight loss. Chronic inflammation can lead to feelings of fatigue and weight loss. Intestinal inflammation requires evaluation by a doctor for diagnosis and treatment. Your doctor can perform the necessary examinations to make a proper diagnosis based on your symptoms, medical history, and test results. Treatment is usually supported by medications, dietary changes, or sometimes surgery. In the case of intestinal inflammation, it is important to follow the treatment plan recommended by your doctor. It may also help to review your eating habits to relieve symptoms and reduce inflammation. Thank you for watching our video. Subscribe to the channel and like the video. We wish you a healthy life.